Okay, imagine this for a second. A practice that's thousands of years old, something maybe you'd associate with, I don't know, spiritual rituals, or maybe a call to gather people.
Hmm.
What if that could actually be a simple, accessible treatment for a really common and quite dangerous health condition?
It sounds almost too good to be true, doesn't it?
It really does. Today, we're doing a deep dive into some truly intriguing new research on something called shank blowing. That's blowing a conch shell
Right, the shankh.
and its potential impact on obstructive sleep apnea, or OSA.
Yeah, and what's really fascinating here is how this traditional wisdom is meeting, you know, proper scientific investigation. It's offering a whole fresh perspective on managing a disorder that affects millions of people across the globe.
Millions, and often goes undiagnosed, right, or untreated.
Exactly.
Yeah.
So our mission in this deep dive is to explore a recent study, a randomized controlled trial, actually. It looks specifically at this ancient yogic breathing technique.
Okay.
We want to uncover how it might work, how it could potentially strengthen those critical upper airway muscles
Hmm.
to combat the root cause of OSA.
Right. So let's start there. Let's get a clear picture of the problem itself. Obstructive sleep apnea. If you've ever heard someone snore really loudly, or maybe you struggle with it yourself,
Hmm.
you might have a basic idea. But OSA, it's way more than just noisy sleeping.
Oh, definitely.
Yep.
It's a really widespread sleep disorder where basically throughout the night, your breathing actually stops.
Repeatedly.
Stops completely.
Yes, because the airway gets obstructed, it collapses temporarily.
Yeah.
And these pauses, they can last 10 seconds, sometimes even longer.
Wow.
And it can happen hundreds of times in a single night.
Hundreds. It's hard to imagine. And these interruptions, they must have serious consequences beyond just, the snoring.
Absolutely. They lead to really poor quality sleep, which often shows up as just feeling exhausted during the day, excessive daytime tiredness.
Right. That makes sense. But the risks, they don't stop at just feeling sluggish. OSA significantly bumps up your risk of serious health problems. Things like high blood pressure, cardiovascular disease, even stroke.
So we're talking major health implications here.
Definitely. This isn't just about being uncomfortable or tired. It profoundly impacts quality of life, and it carries these significant long-term health burdens. That's why finding effective, accessible treatments is just so incredibly important for overall well-being.
Yeah. So for someone living with OSA, it's not just feeling tired. It's serious long-term risks that can touch almost every part of your life: concentration, heart health, everything.
That's right. The impact is really profound, which, as you said, is why effective solutions are so critical.
So what are the current solutions? What's the standard approach?
Well, for many years, the standard treatment, the gold standard really, has been the CPAP machine, continuous positive airway pressure.
CPAP, right. I've heard of that.
It's a device, essentially. It delivers a constant stream of air through a face mask while you sleep, and that air pressure keeps the airway from collapsing.
And does it work well?
Oh, yes. CPAP is, without a doubt, highly effective. It often leads to really dramatic improvements in sleep quality, and it reduces those serious health risks we were just talking about.
Okay, so it sounds like a perfect fix, almost. On paper, anyway.
Well, here's the catch. Here's the challenge. CPAP is effective, yes, but only if people actually use it consistently.
And do they?
That's the problem. Dr. Krishna K. Sharma, who led the research we're discussing today, he's from the Eternal Heart Care Center and Research Institute in Jaipur, India. He highlights this point. Many patients just find it incredibly uncomfortable.
Uncomfortable how? The
Yeah.
mask.
Yeah, the mask, sometimes the noise, the feeling of being sort of tethered to a machine.
Yeah.
They struggle to use it every single night.
I can see how that would be difficult. It really highlights that even the best treatment isn't much good if it doesn't fit into someone's actual life, does it?
That's such a crucial point. Patient adherence is key. If people can't stick with the treatment, no matter how good the science is behind it, its real-world benefit just plummets. And that really underscores the need for alternatives. Accessible options that people might actually integrate into their daily routines. It makes you ask, can some of these older traditions, this ancient wisdom, offer practical solutions? And how do we test that scientifically?
Especially when the main treatment has these adherence issues.
Exactly.
And that, I suppose, is where the conch shell comes back into the picture.
Precisely. Shankh blowing, or conch shell blowing. It's been a practice in India for, well, literally thousands of years, deeply rooted.
Not just ceremonial, then.
No, it's more than that. It's intrinsically linked with yogic traditions, which, as you know, often emphasize controlled breathing, breath work for both physical and mental well-being.
Right. Pranayama and things like that.
Exactly. and now it's being looked at for its specific physiological impact. It's fascinating, really, how long these practices have been around, and only now are they getting this kind of scientific scrutiny.
So what prompted this particular study? Was it just the tradition?
It was actually sparked by Dr. Sharma's own clinical observations. He started noticing that some of his patients, the ones with OSA, were reporting feeling better, more refreshed.
After doing what?
After regularly practicing shank flowing, they noticed fewer symptoms themselves.
Just based on their own reports?
Initially, yes. These anecdotal reports were compelling enough that he decided, right, we need to study this properly, let's conduct a scientific trial, and really see if this ancient practice could be a useful, simple treatment option.
Okay, so moving beyond anecdote to actual controlled research, tell us about the study design.
Yeah, so this wasn't just collecting stories. It was a structured, randomized controlled trial. Very important.
Okay.
They enrolled 30 people, all diagnosed with moderate OSA, adults aged between 19 and 65.
And where did this take place?
At Dr. Sharma's Institute, the Eternal Heart Care Center and Research Institute in Jaipur. This was between May 2022 and January 2024.
And what did they measure at the start?
Before any intervention, everyone had a baseline assessment. That included polysomnography. That's the comprehensive sleep study test. It records brain waves, oxygen levels, breathing, heart rate, all of it. It gives a detailed picture.
Right, the gold standard for diagnosing OSA.
Exactly. And they also completed questionnaires about their sleep quality and how sleepy they felt during the day. Standard stuff.
Okay. Then what? They split them into groups?
Yes, randomly assigned.
Okay.
One group was the CONCH group, 16 people. They got in-person training on how to actually blow the traditional shankh correctly.
And the other group? The control?
The control group, 14 people. They were taught a specific deep breathing exercise. This was crucial, right? To make sure any benefits weren't just from any kind of focused breathing.
Good point. So comparing shankh blowing to just deep breathing?
Precisely.
Yeah.
And both groups were asked to practice their assigned technique for at least 15 minutes a day, 5 days a week.
For how long?
For 6 months. After those 6 months of practice, everyone was reassessed using the exact same tests they had at the beginning, the sleep study, the questionnaires.
A pretty robust design then. 6 months is a decent amount of time.
Yes, absolutely. Key to drawing meaningful conclusions.
So the big question, after 6 months, what did they find? Were there differences?
Oh, yes. The results showed really quite clear and compelling differences between the shankh group and the deep breathing group.
Compelling how? What improved for the conch blowers?
Well, what's striking is the measurable impact. This wasn't just people saying they felt a bit better. They saw objective changes.
Okay, like what?
For starters, the shankh group reported feeling 34% less sleepy during the day compared to the control group.
34%, that's huge. That would make a big difference to someone's daily life.
A massive difference in alertness and quality of life, absolutely. They also reported better overall sleep quality.
It's objectively better sleep.
Yes, but also, crucially, objective measures improved. They had, on average, 4 to 5 fewer apnea episodes per night. Those pauses in breathing we talked about.
4 to 5 fewer times they stop breathing each night. That's very concrete.
Very tangible reduction in the core symptom. And perhaps most importantly, from a health standpoint, they maintained higher blood oxygen levels during the night.
Which suggests their breathing was just better, less interrupted.
Exactly. Better respiratory function while sleeping.
Yeah.
These are real clinical improvements.
That's genuinely remarkable. It really does suggest something physical is changing, not just a placebo effect.
It strongly points that way.
But it still makes you wonder, how? How could blowing into a shell actually change your breathing mechanics during sleep? What's the theory?
Well, Dr. Sharma offers some pretty convincing explanations for the mechanisms involved. The technique itself is key.
How so?
It involves taking a deep breath in, right? And then a really forceful, sustained exhale through tightly pursed lips into the shell.
Okay, so it's not just a gentle puff.
No, not at all. It's controlled, forceful.
Right.
And this action, he explains, creates strong vibrations and significant resistance to the airflow.
Resistance, like lifting weights, but for your airway.
That's a great analogy.
Yeah.
These actions directly strengthen the muscles of the upper airway. We're talking the throat, the soft palate.
Ah, and those are the muscles that get floppy and collapse in OSA.
Right, precisely. Those are the weak spots. So this technique seems to be directly targeting the physical muscular cause of the obstruction. It's like, yeah, resistance training for your throat muscles.
Keeping them toned so they don't collapse during sleep.
That seems to be the idea. And Dr. Sharma also mentioned something interesting. He hypothesizes that the conch's unique shape, that spiraling structure.
Yeah.
That might also play a role. It could contribute specific acoustic mechanical effects that further stimulate and tone those crucial muscles.
So it's not just any resistance. The shell itself might add something unique.
Potentially. It's this elegant combination of the specific breathing technique and the tool, the shell, working together for this muscle training effect.
Fascinating. This really could have some broad implications for how we think about treating OSA.
Absolutely. I mean, what's clear from this initial study is that shankh blowing looks like a promising, simple, low-cost breathing technique.
Simple and low cost are big advantages.
Huge. It could potentially improve sleep, reduce symptoms, without needing complex machines or medications. Think about how valuable that is for people who find CPAP uncomfortable.
Or can't afford it, or just don't have access to it.
Exactly. That remains a major barrier to care in so many places globally. So this research really opens up exciting possibilities for blending traditional practices with modern medical understanding. It could be a valuable new tool in the healthcare arsenal, especially where resources are limited.
And it sounds like this isn't the end of the research road for this.
No, definitely not. The researchers are already planning a larger trial involving multiple hospitals.
To do what? Confirm the findings?
Yes, to validate and expand on these initial results in a bigger, more diverse group of people. They also want to see how it performs over longer periods than 6 months.
Makes sense.
And they want to dig deeper into the science, measure airway muscle tone directly, look more closely at oxygen levels, sleep stages, that kind of thing.
And compare it directly to CPAP. Or see if it helps severe cases.
That's also on the agenda. Comparing it head-to-head with standard treatments like CPAP and exploring if it has potential even in more severe forms of OSA.
It'll be really interesting to see those results. Has anyone else in the field commented on this?
Yes, Professor Sofia Skitsa, she's head of the European Respiratory Society's group on sleep-disordered breathing, based at the University of Crete. She wasn't involved in the study itself.
Okay, an independent expert. What did she say?
She called it an intriguing study. She acknowledged its potential for muscle training in certain patients, but she also emphasized, quite rightly, that a larger study is really needed to provide more solid evidence.
So cautious optimism, but needs more data.
Pretty much. Her comments reinforce that while this initial trial is very promising, bigger studies are the next logical step to really understand its potential, maybe as a standalone treatment, or perhaps used alongside other therapies.
It really does make you think, doesn't it? How much unexplored wisdom might still be just sitting there in these ancient traditions, just waiting for science to take a closer look?
It's a profound question.
This whole discussion really hammers home how sometimes the most surprising solutions can come from the most unexpected places, or, well, in this case, maybe the most ancient ones.
Yeah.
We've seen how this practice, shankh blowing, steeped in thousands of years of culture, is now showing real, scientifically measured promise for reducing OSA symptoms, improving sleep quality.
Based on a solid randomized controlled trial.
Right. It's a powerful reminder that innovation doesn't always mean high tech. Sometimes it means looking back, but with a rigorous scientific eye.
It forces us to reconsider the value, potentially, of practices that maybe were dismissed as just ritual or spiritual, to actually examine the physiological effects. The idea that such a simple, ancient act could benefit a modern medical condition is incredibly thought-provoking.
It certainly is something to ponder, isn't it? The possibility that blowing into a shell could genuinely lead to a better night's sleep and better long-term health. A truly fascinating deep dive today.